is adolescent skin. She has held several workshops, mentorship programs, and seminars with various schools and colleges all over India, working extensively with teenagers. She is the alumnus of Savai Mansingh Medical College, Jaipur, and Image Group of Hospitals, Hyderabad. By the pen name Manita V, she also published, author, and a best-selling novelist, and has featured in multiple podcasts and articles. Thank you so much, ma'am, for taking out the time and being with us here today. And we're looking forward to what you have in store for us.
Thank you. Thank you, Vani, for giving such a lovely introduction. And hello, everyone. I'm Dr. Mamta Batra. Like Ivani introduced me, I am Chief Dermatologist and founder of Noise Skin Plus Skin Laser and Aesthetic Clinic based in Jaipur. And for past 12 years, we have been working with different patients who come to us for dermatological issues. But our key focus and my expertise is mainly in adolescent skin. So I've been talking to a lot of teenagers all through these years, and sometimes for skin issues and sometimes for other issues also. So when I was asked for this opportunity to talk to the students and all of you guys, so I just took upon this opportunity and thank you so much. I'm so excited to talk to you. So today's topic is SOGIE, that is sexual orientation, gender identity and expression, and the health disparities. So, the topic goes first, today we'll only be taking the basics because this is a very deep topic. It needs depth of understanding that a lot of people in our community don't have. So, I would always encourage everyone to read about it, educate yourself, know more, and read blogs, read tweets, read articles, read everything that is available, especially the laws that are being formulated from time to time, the what Indian Constitution says, what the doctors say, and then go about passing a judgment or not passing a judgment. It's more about unlearning what you already might have inculcated in you due to societal or traditional norms. So what we'll do is today we'll just take the basics and we'll discuss why we need to talk about it, why it is being taught so much. So what happens is like with the objectives, what I would like all of you, all the listeners today to take today is one, the scope of conversation. Every problem has a solution. If if we are taking it as a problem, and yes, it is a problem in the society, that some people are not being treated equally. So we need to start talking about it. The scope of conversation is very important. Second is empathy. Unless and until we are able to put ourselves in someone's shoes and imagine what they are going through, what they are facing, whether any discrimination or ridicule, mocking, anything that they are facing, and they're talking about it, that yes, we are being made uncomfortable. So we should know why we have made an environment so unfriendly or uncomfortable for certain section of community to feel not welcome, right? And the third thing is improve the scope of education. There's nothing wrong in accepting that I don't know much. Whatever is it's a very simple thing we have made from time immemorial. We have made certain set definitions and criteria for normal and not normal. The traditional and cultural definitions, we have just, we have set a box. So anything other than that, deviating from that is considered abnormal or unnatural. And even till last few years, we have been, as a community, as a society, and it's not just in India, all over the world, they have been terming homosexuality or gender orientation issues as mental disorders, psychiatric problems, and they take it as unnatural. So, what we can do about it, there is no harm in learning more, educating yourself more, and knowing what it is. So, the very first thing that we need to learn from starting from here is, and a very good example that I'll give you is, This April 28th, 2021, the Madras High Court Judge, Justice N. Anand Venkatesh, he deferred his judgment on a case raised by two same-sex women who wanted justice in a certain case. He did not pass a judgment, and he said that, wait, I'll go for a psychoeducative counseling. First, I'll learn what it is. So that sets an example that you shouldn't pass judgment without learning. So he went through all the counseling and everything, everything, learned about it. And then he specifically said that your personal ignorance and your prejudice, it is no justification for discrimination. Just because you are ignorant and just because you have certain prejudice in your mind that this is not right, that doesn't mean you'll discriminate. So it's better to learn more. So this is one thing. And the second thing is, which is very important for us to know, is what does Indian Constitution say? Anything which does not go by the laws of the articles and the laws laid by Indian Constitution is a violation of Constitution, and our Constitution gives equal rights to people who are from LGBTIA plus community, and they say that any discrimination on that basis is punishable by law. Okay, so these things first we should keep in mind. Then what else we'll talk about today is the specific concepts, because first of all, everybody is confused what exactly it is and how should we not discriminate, like what should we know about it. So the specific concepts of gender and sexuality are important to know. I'll just tell you in brief about it. And why do we need to learn about them is very important. What are health disparities? Why do they happen? What can we do to bring about an environment of equality, and what are the resources to recover? So the first thing starts with what is SOGIE. The differences in sexual orientation, gender identity, and gender expression. What happens is, it's a very basic thing that everyone needs to understand. There are four parameters that you should understand. One is biological sex. It is very simple. All of us know biologically, if you are assigned to a certain sex, which is your biological makeup, your chromosome structures, your genitalia, which a person is born with, is like everybody tells you, you're a boy, you're a girl. So that biological sex is, that is the first parameter. On that, one extreme is a man, which like male, and one is female. So between all that, people who do not have one set of genitalia or one set of external sexual characters are called intersex. They have both. So this is one parameter. Second is gender identity. Now, what a person identifies in his brain, this is not about external. This is about your chemical composition, your hormones, what you identify with. So it is not related to what you were given or assigned at birth. You might be a man or a male or a female at birth, but in your mind, you identify more with one particular or both. So in this one extreme, one set of people, they identify themselves as men, and one set identifies themselves as women. These are two extremes. Now between both, there is a big spectrum who identify as either both or none or cross. Like you may be assigned female at birth, but you may identify yourself to be a man, or you may be a man assigned genetically as a man, but in your mind, you think you are a female. And there is a big spectrum in between who identify with both. Sometimes they feel they are male, sometimes they feel they are females. And there is a queer group or another Q, the Q is assigned for queer and questioning. Another group is questioning. They are so messed up because of social conditioning and their internal hormonal changes. They're not able to understand, especially in the period of adolescence, that what exactly do they identify with. So that is one. That is second parameter. Third is gender expression. In your mind, you could be identify with a man or a woman, but you are not able to express it. So your expression, gender expression, is how you express it according to your society, like a man dresses up, is supposed to dress up as a man, and that it is masculine, whether you are expressing your masculinity or feminism. So femininity, and in between there is a big, again a big spectrum, which is like androgynous. Some people dress up as both. Some people express themselves as both. So that is gender expression, how you express yourself. So it could be it can also be called as gender conforming and non-conforming. Some conform to the expectations or to their identity, either to biological sex or to gender identity. Some they don't conform. So that is called gender non-conforming or conforming. The fourth parameter is sexual orientation. Orientation is one parameter, is like at one spectrum. A lot of people, majority of people, they are attracted to the same sex, so to the opposite sex, that is heterosexual. Some people, like 2% currently in India, they accept being attracted to the same sex, and in that there is like homosexual, we don't use the word these days, it is banned now. So the men attracted to men, they feel attracted to other men is gay. Females, they who are attracted to other women, other females, they are lesbians. Transgenders, again a big spectrum in between, it's an umbrella term. And then there are bisexuals who are attracted to both the group of men and women. And it's a complex, it's a complex spectrum, because how you express yourself, how you identify yourself in your brain, where you are oriented to, and how you were born, that is why so many identities, and that is why so many definitions. But one thing is, we should, like you should keep an environment so open that a person is able to express what he's feeling, what he's identifying, and according to that, he's able to seek whether medical help or whether psychological, sexual help, because these are the times when a person is most confused, most worried, and most afraid. The fear of judgment, the fear of being mocked, especially when there is peer victimization. Most of the class is looking down upon you. That is peer victimization, social stigma. The relatives are coming back and saying what's happening to your boy or what happened to your girl. Then they have a very strong fear of family rejection. A lot of families are not able to accept, and then they take the kids to either babas or for treatment. So even till last year, there were conversion therapies going on. It is only banned 2 weeks ago on 7th June 2021. The conversion therapies are banned in India now. So I'm really proud of it, the way Indian, the Supreme Court and our government is doing a lot for the community, because it is very important to know, like 2 3 things I tell you, it's very important. There's Dr. Kimberly Crenshaw. She proposed a theory of intersectionality. That means we as individuals are, we are taken as a unique individuals and identity based on our different socioeconomic categories and different access, like your age, your race, you are Asian origins, you are, whether you are an Indian, what is your age, what is your class, where do you belong. So this is what makes us unique. These are individuals. So Dr. Kimberly said that says that the theory of intersectionality says that we should include our sex, orientation, sexuality, and the identity, that we, our abilities and the sexual identity as a part of that. So don't see that different from a person. You have to like a person, not his orientation. You have to like a person, not how he identifies him. You are in educational institutions, in jobs, while interacting, making friends. You are not supposed to see a person's gender identity and then discriminate him. So that is punishable by law also. And why we are talking to the schools, colleges, they should be sensitized more, because you are the future generation. They can make a change. You all can, make a positive, constructive change. The government is making its policies and laws, but we need to understand that a person's sexuality, orientation, likes, dislikes are not in his hand. It is not a disease. It is not unnatural. It is not in your hand that you can correct it. You cannot cure it because it's not a disease. And in February 2014, Indian Psychiatric Association has actually stated that there is no evidence that all the entire spectrum of homosexuality, it is based on neurological and biological factors, and it is not in our hands. It's natural and inherent. So there's nothing like treating them. So the science of sexuality theorizes that every individual exerts little or no control over how he is feeling. The feelings come from hormones. So especially the sexual spectrum. So any discrimination on that basis is not right. It cannot be taught, it cannot be forced, it cannot be influenced. You cannot, because there is a very talk therapy, very common. It used to be common in India that you will talk it out, that you tell him that you are letting your parents down and it's not natural. Your parents didn't bring you up well. That is why you are feeling like that. So that is talk therapy. There is hormone therapy. What happens is they're giving injections like trans men. They make them trans men and trans women. They try to change how a person feels by giving hormonal injections, male hormones and female hormones. And the most barbaric or maybe inhuman was electroconvulsive therapy, which is used for refractory mental disorders. So what they do is they pass a mild 70 to 110 volts current in the head, and they try to induce a generalized seizure to alter a person's thinking. It was used for refractory mental disorders, but they used to do it for homosexuals. Will not use that term, for LGBTIA plus community as well. That is being banned now, and conversion therapy as such is banned because they have their other than physical issues, they have depression and anxiety they can cause, and a lot of a lot of other issues like suicidal tendencies, mood disorders, the feeling of rejection. So all these are side effects of conversion therapy. So again in June 2018, the Psychiatric Society, they stand by the LGBTI community and they say that we don't need to castigate, punish, or ostracize the LGBTIA plus Q community. So we have sufficient data that these guys, the entire community, is facing social stigma, social rejection, family rejection, and that includes health disparities. Why do we need this talk? Because health disparities have been occurring since a long time. One, they might not have proper insurance. They might come out late, and they reach out late to the healthcare officials for their issues. There are no prevention strategies, prevention interventions for preventive therapies, for screenings like cervical carcinoma. There are no screenings and no separate provision for them. So there is no harm in knowing what we can do about it, how we can go about it. And in recent years, there are lots of rules have been changing, lots of identities have been coming. So it's very important to know these things. Then we call them socially vulnerable group. So what happens is, as healthcare providers, we should be on our forefront. Like the healthcare system should equip itself to help a particular community more, because that is a vulnerable community. And medical ethics says that healthcare should be equal for all. There is equal right to healthcare. So both philosophical and political and health-wise, the healthcare system, we need to ensure that we are making a system friendly and fair and equal for everybody. The most, like one of the important drawback that we have is the healthcare providers, not just doctors, but the entire staff at the hospital, from nurses, compounders to from the front desk till the doctor, the operating surgeon. They do not have specific trainings which sensitize them to, against prejudices and discrimination. So right from the front desk till the doctor's cabin, a person suffers so much stigma that they might not be able to, they don't, they we have data which says that they get so harassed, and they get verbal abuses, and then there people don't allow them to sit together, and they, mocked and ridiculed. They are people passed comments. So what we can do is like little basics we can introduce in training, and we can understand what risk they are facing, and so that we can screen them properly and give them proper space to, express themselves. Because basically when you are not represented well, and there are no role models, people feel marginalized and ostracized. So, there are some certain health diseases. See, most of the diseases, when we say health disparity, the disparity is inequality. Inequality with equal healthcare is not available for everybody. There's differences in healthcare. Most of the diseases are not different. It's our social determinants and our approach that causes different outcomes. So majority gets tackled there once we give them equal treatment, equal respect, equal, opportunity to access healthcare. Most of the problems are solved. But there are some problems which are separately major concern. The literature review says that there are behavioral concerns and physical health, and something I'll talk about the dermatological aspects because I see them regularly in my clinic. So behavioral aspects, because of the stigma, because of the rejection and all these therapies, a lot of people, they're already battling with mental issues. There's depression, there's anxiety, there are very large community expresses suicidal ideations, and people commit suicide also. Suicidal thoughts are always there. There are mood disorders, and there are eating disorders, especially the eating, the stress eating. It leads to obesity. So a lot of lesbian females and gay males, they complain that weight gain and obesity. And a large population reports alcohol, tobacco, and drug abuse. So these are the behavioral disorders that are commonly found in LGBT community. The physical health, uh, a lot of gay and bisexual men, they're more likely to have HIV/AIDS. Females, like I already told you, obesity. Then and higher incidence of papilloma virus infection, and then lack of screening leads to cervical cancers. They are not screened early, they are not vaccinated, and they don't seek healthcare. So breast carcinomas and different carcinomas, because they just they come to the healthcare provider at a later stage. They don't come early. A lot of people, a lot of companies, they don't insure them well, to consider their needs and then insure them. And they don't come for regular follow-ups because they avoid going out in public or meeting a doctor or a healthcare staff who's prejudiced against them. So there, and we are talking about the skin aspects, the dermatological points. Just one is the transgender people face a lot, like I already told you, the gender affirming therapies, like hormone therapies. So trans males will have more of, like they have under recognized and under reported disease because they have more of acne, and people tell you this is so normal. Acne to hota hai. So it reaches a scarring stage also, and yet they don't turn up for treatments. They get different surgeries, so post-surgical keloids, and sometimes scarring after surgery, or due to silicone injections and altering body contouring, there will be reactions. For females, like trans feminine patients, there will be increased hair growth in the body, pseudofolliculitis barbae, which is razor bumps, melasma, tanning, complications of um, body, like I told you, body contouring complications. And then sometimes there is body image dissatisfaction, even if they have a good body, because constantly somebody is telling them that you're not perfect, there's something wrong. So that leads to mental health issues. And it's mainly because they are not supported, they are not accepted, they are isolated. And a lot of studies tell us that people from transgender communities and LGBTQ plus communities, they've refused healthcare or delayed healthcare because of one of these issues. They have postponed because it's not that it's in their mind. They have faced discrimination. They have been derided, they have been ridiculed, they have been looked down upon, and they have been mocked. So what we can do is, first thing, like I'll tell you about the more solutions that we are looking for. So we'll go for why these disparities occur. One is they're already a minority. See, the prejudice is there in our minds. That is one thing, but they're underrepresented. It's a minority. There is lack of specific education both in schools. There's nothing included in the curriculum, and there is a mindset block for everyone. Other than that, all the diseases or disorders which are specifically found in LGBTQ plus community, there's lack of research. How many, how frequently, what to do for that. So there are no guidelines. And then fear is always there. So what are the solutions? What can we do about it? See, first thing is, like I tell you, I tell everyone, for everything, not this, for everything. The first step is conversation. The first step is accepting there is an issue. It's not like no, we don't do that. We do that as a community. There is still a mindset block. So the first step is acceptance that this is happening. So accept their prejudice, their fear, accept that there is discrimination. Now, what can I do about it? And as a society, what can we do about it? Conversation is important. Talk like this. This is a very good endeavor by all of you guys that you're, organizing these talks and trying to learn more. So learning, reading more about it, reading the laws, going ahead and conversing. And if there is somebody around, don't let them feel singled out. It's okay. You don't talk. सबसे पहले, the first thing is don't assume, ask. The people from LGBT community, they are everywhere. Every country, every race, every religion, every social class. So just because a female is standing by you does not mean, because physically you can see a female because of her expression, gender expression. You should not assume that she identifies herself as a feminine. So in our clinics, we have started doing this. This is the first step is don't assume. Before writing the name or before getting the forms filled, we always ask like, how do you identify yourself? Like, do we, are you comfortable with this pronoun, or just ask what pronouns do you want us to use? Whether it is some people use he, her, he, his, or she, her. And sometimes we use gender neutral pronouns, as them, they. So what name should I write for your legal and insurance purposes? That name sometimes is different from what name they carry. How do you identify yourself? And if someone shares with you, it's fine. Don't we shouldn't look or talk like, oh, it is something different. Asking more questions out of curiosity is also discriminating because it puts the person on a back foot. We are on only the initial stages of removing. It's not a easy journey. It's a tough journey. The government is playing its part. We have been doing very well as compared to a lot of countries, the government of India and the Supreme Court. So there are so many guidelines that have been raised, and there is a transgender person's protection of rights accepted in 2019, and Section 377 was repealed off. It was an archaical colonial era law that was repealed off. So we are doing a lot. As doctors, we try to ensure a safe environment so that a person does not feel afraid, because we need to understand that the person is already afraid. He's already, he's faced a lot. So just we try to, like what I do in my clinics and what I have been talking to my friends, like as doctors, our duty is to ensure a good quality health care. It should not matter to us that a person who's coming to seek help is a male or a female or a masculine or a feminine or a transgender, or identifies with any identity of LGBTQ plus. It does not affect, it should not affect who we are as doctors. So we should ensure quality healthcare and subtle things like subtle cues in your clinic. You can put like we do that, putting a little rainbow for them. The other people don't mind, or they actually overlook. It won't mind. You might ignore if you are from one particular identity, if you don't think about much. But if a person is from a transgender community, he will notice that rainbow. So he will feel welcomed, and he will feel easy, welcomed to share his thoughts, and he will talk about it. Let's not say he, they will talk about it with more openness. So we are trying to make it more inclusive, the healthcare, the way we talk to our patients, building trust, ensuring specific measures, the forms that we get filled. It's like when we write the gender, it's like male, female, or others. And then if you want to specify, it's fine. If you don't want to specify, it's fine. There's no, even while writing down, we should always ask that, should we write down your pronouns? Are you comfortable me writing? Because for certain treatments, it is important. Certain hormonal therapy that you've already been going, and I have to treat you. It's important to know what therapies you have taken. But if it is not important, we shouldn't ask. We should refrain from asking. So building trust is very important. And then we should always assure confidentiality. Like if someone has trusted in you and he's still not sure that whether his family is going to take it positively or his friends, then you should very positively maintain confidentiality. You're not supposed to out it unless only a person should, out it. So healthcare providers are a very important bridge, and as doctors, we should give them comprehensive, scientific, and unbiased, humane care as long as possible. So it is very important to understand the importance of addressing the issues. Once you start addressing the issues, you'll find out that internally I need to train my staff, train the front desk, train the people to tell them no, there's not going to be any discrimination in my clinic. Externally, when you talk to the patient subtly, you talk other people also. Like if a transgender person is visiting a clinic, the doctor needs to ensure, or the highest authority needs to ensure that the other people around, the customers, the clients, the network of healthcare providers, the doctor who's not seeing, or there's a multidisciplinary approach. So the other doctors who are seeing, or the person where he's referring the patient, also treats them in a unbiased manner. So the network has to be expanded. Then there should be specific trainings, more guidelines for us as a community, for students. Like I said, don't assume, just ask. There's no harm in asking people. If you are unbiased and if you are asking with a good intention, people will be more readily, diverging. Like, okay, I identify with this, and I would like to be called this. I don't want to be addressed as this. This is my label. And always be empathetic. Empathy takes you very long, in not even with transgender community, but with everybody. Try to put yourself in somebody else's shoes. Understand why someone is going through a fear or a prejudice. Advocate for them. Suppose you see someone being ridiculed, or just don't stand like a bystander. Just go and tell people, listen, we have been, like as a society and government, they have been given protection of transgender rights by the Constitution of India. So the discrimination is against the Indian Constitution. So when the government is asked to implement these policies, and when the government and the entire system is asked to protect their rights, then a single individual, or a group or a community cannot ask them, like whether it is a public place or a educational institution or any other community efforts, the community roles. Any person with a different sexual orientation or identity should not be excluded. That's the entire reason why we are talking and why we need fairness and justice. So the most, like I said, the conversation, the empathy, the learning. Education is very, very, very important for everything, especially for things we don't know. We should always try to learn, read more. A lot of your prejudices will be washed off because they have been ingrained in you by some traditional things. So it's not harm to read. So read, research, make your own research. And there are certain resources if someone wants to reach out. So there are certain resources like NAS Foundation is a very big institution based in Delhi. They're doing a lot of work for LGBTQ plus community, and their branch is Sangini Trust. Again, it's based in Delhi, and it works for queer women. What happens is they give you legal help, they give you resources to read, they give any other counseling help, and then emergency services. If someone is being mistreated, you can just reach out to them or tell your friends that these are the institutions. There's Hamsafar Trust based in Mumbai and Delhi. Umang is based in Mumbai. And there is Human Rights Law Network. Human Rights Law Network works pan India across all states. They work with uh, every section of society. So there, one section works for LGBTQ plus also. So human rights is always there to protect them. And these are the basics that I wanted to talk with you guys. And I would like to end it with two statements. Like I told you in Madras High Court, Dr. Venkatesh, when he passed this judgment after reading and after going through counseling, when he finally passed the judgment, he specifically states that I'll read it. The responsibility to change the burden and the burden of unlearning the stigma and learning the lived experiences. It lies with the community. The lived experiences of queer group, the queer community, it lies with us and not with them. It is us who have to set off on a journey of understanding them and accepting them and shed our notions. It's not them because they have to change themselves inside out to suit our notions. They have for years, they have been living a different identity of what society wants from them. And imagine yourself living like what others for your entire lives, hiding your identity, not having access to everything that everybody else is having, and then living a life that everybody else wants you to have. So this is a landmark judgment where he specifically states that the responsibility lies with us to educate and to build a society where our interest of every individual is protected, right? So our notions of morality and tradition should not, should not enable discrimination. It should enable a good society, right?
Doctor, I know
So
I
thank
speak
you so much.
I
Yeah,
know I
please.
speak for everyone when I say that I've learned so much today, and I feel like everyone has educated themselves about what the community is about. However, we're deprived of the technical side of things, which now that I've learned about really brings things into perspective. And I do believe that India is a little behind. However, like the conversion therapy being banned and the judge who went to therapy to educate, it's baby steps, but we're getting there. And soon I think we're going to reach to a place where there is actually a friendly and equal and fair system. And hopefully with these webinars actually starting and like you said, a conversion being conversation being started, transgender won't transgender people won't have to, postpone their healthcare because of discrimination, or soon, hopefully, in the foreseeable future, we will shatter the stigmas, and the doctors and the whole healthcare system will be more inclusive and unbiased.
I'm really glad helped you. Thank you so much for giving me this opportunity. It was lovely talking to you.
Thank you so much, ma'am, for such an informative session. Furthermore, we'll be taking questions from the attendees. So please feel free to ask the questions using the Q&A box, or you can raise your hands using the Zoom feature so that we can allow you to speak.
had a question. Doctor, what are some of the ways you think we can promote inclusivity in school? Because in school it's pretty gender that you're either this or either this. You're either female or male, and even the bathrooms in school are female or male. So, what are some of the ways you think that we can make it a more gender neutral place for students in school?
Yes. See, first of all, it in school. First thing is you should the authorities have to do something. First, they should ensure that you will be not biased in this, and you can the label, like you said, the washrooms are male and female. So a person who identifies in a certain way should be allowed. It should not be, first is when you make an environment that they are accepted. So they will automatically feel comfortable sharing what they feel like. So if a boy is identifying as a woman and is feeling uncomfortable with other men, they should be given ample space. And suppose if they are not able to, because it's a big school, there is a lot of students, you can't sensitize everybody together. So there could be certain timings said that okay, these are or this particular section of washrooms or a particular place is just for people. You can put a rainbow thing or something. The authorities can ensure that this is so whether you're identifying as a man, male, or a female, or a man or a woman. So they, if they feel accepted, and if there is a certain section where they can go without fear. If that is being done, that is also a first step to ensure. And there should not be any like there should be like we say in Indian Constitution, there is punishment. So there should be a sensitization that anybody who's found mocking or ridiculing or talking about in a deriding way should face punishment. Because see, personally, I'm not in a favor of punishments, because what we can achieve by conversations and explaining things, we cannot achieve that by punishing. But to begin, if we start imposing such fines or something like that, um, a punishment could be talking to that person and listening to him for around 15 minutes or one period. Listen to him and see what they are feeling, what she or he is feeling. So it will begin a row of examples that will be set, and then the teachers or the principal can ensure that a certain section of washrooms or a certain section of rest areas, or where you go to change, like during swimming and all these places, there could be a certain section which is exclusively for transgender community.
I think that makes a lot of sense because if they feel comfortable to talk about if we make a comfortable environment where they are allowed to talk about what they exactly feel, I think that we'll be able to solve the problems much better because we know exactly what they want. So thank you so much.
Exactly.
Right. So from the attendees, we have Maisha ask a question. Let her talk. That's Maisha.
Yeah.
Hello, good morning, ma'am. I'm Maisha from JPIS. My question, first of all, I'd like to say thank you so much for the session. It was genuinely very informative and I enjoyed it a lot. And
Thank
I
you.
had two questions. I had
Yes.
two questions. One, what if a person is attracted to male, female, and non-binary people? What would be their label?
See, every day, a new definition, a new labeling is coming, and a lot of people, like I'll give you an example. There's a queer group. So some people, it's an umbrella group. So some people are very proud to wear it like a badge that we are from queer community. A lot of people, they don't like the term. They said that it's insulting, derogatory. It should be banned. So the best is to ask that person, how do you identify yourself with? If a person is attracted to both males and females, they're usually bisexuals, and like we write it as bisexuals, that person may not like the term. So it's always better not to assume. and just ask him, would you like to, share what do you identify with or what label you want me to write, or we can go without labels. So it's like we say the term is like a person who's identified, who's attracted to both males and females, and he's a bisexual.
Thank you, ma'am. I also wanted to ask about your views on micro labels, like a biromantic lesbian or like demisexual, because in my opinion, you know how lesbians are related to only women, no men are included. But a biromantic lesbian would be that the person is just romantically attracted to a man, but sexually attracted to women. So wouldn't that be invalidating towards
Yeah,
lesbians?
again, it's this, the answer will be the same. See, every person is a unique set of, like I said, intersectionality. A person is a unique set of traits, unique set of feelings or identities, expressions. So it's always better to go for as comfortable, a description as possible, and that person will be able to tell you the best. That I am like this. I am a demisexual and I get attracted to this section. But most of the time, there are also people who are pansexuals. There are also people who are asexuals. There are also people who are, they are asexuals at certain times and bisexuals at certain times, and they have a that's called gender fluid. It's gender fluid identity. Their identity varies with time, with situations, or with phases of life. So it's always in my opinion, it's not right to judge. I always tell people, and I don't judge. Let's not judge, let's not assume, let's not give labels. We can only try to understand, because this is something different for us, because we have not been taught that way. Now we are learning a lot of things. So a person, if she comes and tells you that no, I look a female but I feel like this, so they are welcome.
Yes,
Our
ma'am.
job is to make them feel comfortable. Yeah.
Yes, ma'am. I've realized how people have started using labels to please the other person. Like, I've had so many friends who are actually lesbians, but they said that they're bisexuals just to make the other person feel more comfortable with them. So,
Yes,
I'm a fan
that
of.
is the entire idea of conversing. That even if you are a bisexual, you're welcome. You are a lesbian,
Yeah.
you are welcome. And not even in healthcare, but in a community. Like if I have to be friends with you, I will be friends with you, not how you identify with. And it doesn't matter to me, as long as you are going legal, as long as you are not harming anyone. A person is not harming anyone by feeling in a certain way. It shouldn't affect your friendships, it should not affect healthcare, it should not affect the government, right? So it's always better to be inclusive. That's what is the concept of
Yes.
inclusivity.
Thank you, ma'am.
Welcome.
So we have a question from an attendee. So what is the situation in India regarding insurance coverage for the community?
See, insurance sector again, like I said, just 7th June, they have banned conversion therapy. Just 2 weeks ago, 4 weeks ago, 6 weeks ago, end of April, they have come up with some new judgment. So it is changing every day. Different insurance companies have different rules, different laws. They are still insuring a person as a, for basic general diseases, and insuring them as men and women when they write in. Though now a lot of them have started including, registering them as others. So the government of India has, in 2019, they passed a resolution that they have now every right to be registered as other gender. So it changes every day, and it's better to talk to that insurance company that you're going for and be very, very clear about what is their policy of inclusion of transgender people. The every new day, rules and laws are coming. So whenever it becomes a law, a new judgment has come, they are bound to include it. But a lot of conversion therapies which were previously allowed, still insurance companies didn't use to the surgeries, the body image surgeries, they are not covered in insurance. So that is one positive thing. They were never covered by insurance companies. And similarly, any cosmetic where you go for cosmetic changes to improve your appearance. They're not covered by insurance companies. So it is still, we are in the beginning stage, and it's changing every few days.
So with that, I think we don't have any more questions. Thank you so much, Dr. Batra, for taking out your time and being with us today and educating and introducing such a vastly complicated topic to us. And yeah, thank you so much for joining us.
It's my
Also,
pleasure.
follow Kicking Gender Boundaries on Instagram. Follow Kicking Gender Boundaries on Instagram for more regular updates on speakers in the coming week. Thank you.
Thank you so much for inviting me and for listening, being such a patient audience, and because I went on and on. So, anytime if any of you has a question, I always say either read, look up, or talk to your seniors. You can reach out to me at any time at my email ID or at my Instagram or Twitter channels. You can just reach out to me, ask questions, share your issues. I always listen, and a lot of teenagers and adolescents are dropping messages to me every few days for everything except skin disorder. Like they visit me for a skin disorder, and after that, they just continue to write me for everything. Even if they achieve anything, they just write to me. So you're always welcome to come and talk to me, or any senior you feel comfortable with. And I wish all the best to the Kicking Gender Boundaries. It's a very nice initiative that you all have taken. All the best.
So much, ma'am.